I started working in the NHS in 1983 as quite a junior administrator, and then worked through to 2006, spending about the last 7 years being an executive director. I then took early retirement in 2007 on health grounds, became an access consultant, then became a non-exec of a primary care trust, and I'm currently a non-exec of East Sussex Healthcare Trust. During that time I've also had something of a medical journey, and in 1996, quite out of the blue, I lost the vision in my left eye. It just sort of, over a sort of period of 3 or 4 days, was like somebody was turning the dimmer switch down in it. Following that, I got diagnosed with multiple sclerosis. In the latter part of 2007, I had a really big relapse. I got admitted to the local district general hospital and given the normal treatment that you get for a relapse, which is intravenous steroids. And then I basically spent the next sort of 11 days after the 3 days of steroids in bed, not really mobilising. I could move my legs a little bit in the bed, but didn't really get any other treatment at all. It was then decided after, I suppose, probably 10 days, I guess, that it would be good to transfer me out of the acute hospital to what I've called there a rehab unit, but in truth it's probably more like an older person's unit. After sort of, the first couple of weeks there, I wasn't really getting very much rehab. I got told probably after 2 weeks that it looked like my legs weren't going to work again, and you just really need to get over that and get on with it. I was a patient during quite a significant outbreak of norovirus and C. diff, and it's quite a scary thing when you can hear around you people being sick. You learn, I guess, after sort of 10 years of having MS, to listen to your body. But what I was aware of is that I wasn't being listened to with things that I was saying and things that I thought could help my care. Being a patient somewhere for 6 weeks, especially when people know that you've been associated with the NHS, people talk to you and you become very aware about low morale in staff, and it transfers through to you. When you're feeling quite down, that's quite difficult, and I think seeing smiling faces wasn't something that happened very often. I remember getting lots of different advice from lots of different people, most of it conflicting, and not having any pattern. The scary thing for me during this period was that despite my experience, despite knowing my way around the NHS, and knowing that the care that I was getting wasn't really as it should be, I didn't really think or felt powerless to be able to affect that. So the next thing that happened was that I got visited by 2 friends who work in the NHS in London, and they were shocked really to find the condition of me. They saw how thin I'd become, saw, I guess, my sort of frame of mind, and they arranged for me to go to a pre-admission clinic, a specialist neuro rehab unit. I was greeted by a team of people, including a consultant, physiotherapist, senior nurse, OT, psychologist, and they reviewed me, sort of checked how I was. So I got admitted onto the rehab unit, and I suppose the first thing that I realised was how important teamwork was. Everybody pulled together, worked as a team. There was a coordinated story being told to me. It became clear to me very early on that the staff were happy. the ward rounds were inclusive. The ward rounds were made to make me feel like I was really part of it. So it started off with me being asked how I felt, did I have anything to say? The discharge planning was completely different. The occupational therapist lived the routine that I was going to live at home. She would come in at the time in the mornings when my carers would come to me at home, go through all of that, go through the lunchtime routine and the evening routine. A lot is made of hospital care, and clearly in my case the rehabilitation was important, but also the care you get in the community once you've been discharged is really important too. Because you move from an environment where you're surrounded by doctors, nurses, care assistants and other staff and therapists into one where you're living with your family, and you can feel quite vulnerable in that case. And I think it's care in the community that actually makes up for that. What I think I learned from all of this is just how important building a relationship is with the people who are caring and looking after you. Because if you've got that, you feel you can talk to them, you can feel you have a voice, and you can feel you can be listened to. I think being a patient, each time a decision comes before the board, I try and ask the question, how's it going to affect patient care? Is it going to improve patient care? Is it going to improve safety? I spend time listening and talking to staff, trying to judge their mood and morale and happiness. I also try and spend as much time as I can with patients. I think I've learned that you need to view complaints as actual jewels of knowledge. Just finally, a couple of months ago, I was lucky enough to be able to go to the patient safety conference that Don Berwick was speaking at. And he made a point that I think has profoundly affected me, and it's really to remember that the NHS is a guest in a patient's life, and it's not the other way round. And I think if you do remember that, it perhaps makes everything else fit into place. So thank you very much for listening, and I hope that's been helpful.